Well, we're here in a fun place recognizing an even more special person for our Employee of the Month at Kettering Health Hamilton, Michelle Reinsmith. Congratulations.
Thank you.
So you're our Employee of the Month.
Yeah.
And something really, I want to tell you all about this. You were at a sports tournament was going on.
Yeah.
And you got a call and said somebody collapsed.
Mm-hmm.
So they called you and you ran over there, you grabbed your first aid kit and you grabbed the AED.
Yeah. Yes.
And Michelle ran over, got the AED hooked up,
Yeah.
started CPR until
Yes.
EMS arrived. And I got the story here, and it just says the patient was transferred for continued medical care.
Yeah.
But you actually, what happened to the patient?
He had open heart surgery and was recovering.
Okay. So your quick actions made a difference in a life and death difference.
Definitely.
So oftentimes you're dealing with sprains or other things in the moment,
Yes.
injuries that can be a little bit frightening but aren't life-threatening.
Yeah.
But in this case, it was truly at the end of the
Yes.
at the end of the extreme, huh?
Yeah.
So what do you do? What's your role?
I'm an athletic trainer for Kettering Health and for 5 years. My role is a little different. I have several sites that I'm seeing. I work with a local small college. I also help with our public safety, where we help with police and fire returning to work, and help with kind of sporting events at Spooky Nook or any of our high schools that may need help along the way.
So why did you choose to go be an athletic trainer?
In college, I actually thought I wanted to be a physical therapist. And then I was in the athletic training program at Wilmington College and just kind of fell in love with it. So I love being on the sidelines for sporting events. We're kind of the first line of care for anything that may happen to ankle sprains or dislocated shoulders, broken bones, life-threatening events.
Yeah.
Really important to have an athletic trainer there.
It sure is. Now, how long have you worked at Kettering Health?
I've been here 5 years.
Excellent. 5 years. And then how long have you been at Spooky Nook here?
We kind of just help cover here for daily operations or tournaments. So that was just a random Monday night that I was helping here where you might think that something might not happen, but it's really important to be CPR trained and have an athletic trainer at sporting events.
Yeah. Well, you made a big difference. And I know we were talking earlier and you said you wanted to say something about just athletic trainers in general. So what would you want the group to know about what it means to be an athletic trainer and the importance that they make?
Yeah, we have a lot of athletic trainers here at Kettering Health. Most of them at a lot of our local high schools, also working in public safety. So a lot of the stuff you don't see is Friday night football games, big injuries that could happen. Head injuries. So I just want all of us to be recognized for all the hard work we put in the training that we received to make sure we can do CPR.
Yeah. So why did you choose to be an athletic trainer?
I love being that first line to people. We hear about their daily operations. We hear about the good things on the field. Then also being there for them. Maybe we know them a little bit better than anyone else when injuries occur. Head injuries, sprains, strains, everything.
So when you're not on the court or on the field or on the sidelines, what do you like doing with your free time?
A lot of my coworkers and I like to work out, so staying active. And we even do lunch lift. So
lunch lift?
Yeah. It's been helpful to keep all our coworkers active. So.
Well, Michelle, at Kettering Health Hamilton, we get to welcome new life into the world, and sometimes we hold the hands of life ebbs away. But I'm glad you picked up the shift, and I know the person that you cared for when you sprung into action. So I want to say thank you for being a difference maker. Thank you for making this a better place, and thank you so much for just making a difference with your team, and most of all with this patient. Really proud of you. Congratulations.
Thank you.
Now, if I could get some tips on my squat, my workout, maybe you could help me out.
Yeah, we have some really good exercise physiologists too.
All right, let's go check it out.